The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, thank you for joining us this afternoon for this webinar. Today we'll be giving you an overview of the Affordable Care Act and the marketplace, explain some ways that you can get involved, like becoming a certified application counselor organization, and answer some common questions we've been hearing about open enrollment. So to start things off, let's go over a few technical details. And this is a screenshot of your GoToWebinar toolbar. First, you'll see the little red arrow. This expands and minimizes the toolbar. So if you don't see the toolbar, you can click the little red arrow and it will expand the toolbar so you can control your audio settings and to ask a question. Below that, you'll see a green button that mutes and unmutes your microphone on your computer. If you'd like to ask a question at the end of the webinar and will be using your mic, make sure you have yourself unmuted. The button with the little hand allows you to raise your hand. It will let me know that you have a question. If you raise your hand, I'll make sure to send you a private message to check in and make sure you have a question or maybe a technical question before I unmute you to speak. So under those buttons, you'll see the audio settings. You can select telephone if you'd like to listen and interact with us over the phone. Once you select the telephone option, it will provide you with the phone number, access code, and audio pin, which will allow you to ask questions live over the phone at the end of the webinar. If you're having any trouble with sound, use the telephone for the best connection. You can also select the mic and speakers, which allows you to listen to this webinar over your computer. If you'd like to ask questions live via the chat box, there's no need to have a mic. And if you'd like to answer questions live on this webinar, you'll either need to have a mic or call in using your phone. The last and really the most important box is the questions box, which allows you to answer or to ask any questions you have or comments during the webinar that I and the other panelists can see. Submit your questions as they come to you. I'll keep track of them all and make sure that we can answer as many as possible at the end. So before I turn it over to Kathleen and Nita, a couple more housekeeping things. Just a reminder, submit questions in the question box at any point during the webinar. We'll have an opportunity to ask questions live at the end of the webinar, but you have to have your audio settings either through your telephone or mic enabled. We will send a copy of the PowerPoint out at the end or at either later today, early tomorrow, or if you'd like to access it now, it is available now at ohioconsumersforhealth.org. And just a reminder that this call is being recorded. And in order to foster an engaging and safe discussion environment, this is a closed call, and any statements made should be considered as off the record. So today, you'll be hearing from Nita Carter, UCAN Ohio's Health Equity Director. Nita, do you want to say hello?
Hello, everyone, and welcome.
And you'll also hear from Kathleen Geminer, Project Director of Ohio Consumers for Health Coverage.
Hi, everyone.
And I'm Alyssa Chenault, and I'm the Communications Manager here at UCAN Ohio, and I'll be moderating and fielding questions at the end. So to start things off, we're going to give you a brief overview of who UCAN Ohio is and who OCHC is. Nita?
Okay. So UCAN Ohio is a statewide, nonpartisan, nonprofit organization working to achieve quality, affordable health care for all Ohioans. And much of our work over the last few years has centered around the Affordable Care Act. And one of our projects is our Health Equity Project. And our Health Equity Project was started to help us look at how we address health disparities through the advocacy work that we do. And to that vein, a lot of our projects are focused on, how will we create more resources in communities of color. And so to that end, we have been doing a lot of work around this whole navigation issue for the last year and a half. And one of the other goals of the project is to think of ways to more actively engage communities of color in health policy advocacy.
Great, thanks, Nita. And now we'll hear from Kathleen. She'll give you an idea of who Ohio Consumers for Health Coverage is.
Yes, Ohio Consumers for Health Coverage is a coalition with many members, statewide coalition, that focuses on quality, affordable health care for all Ohioans. Its primary focus has been the passing and then the implementation of healthcare reform, and specifically the Affordable Care Act.
Great, thank you, Kathleen. So just a quick overview of the webinar today. We're going to go over the basics of the Affordable Care Act, including the Medicaid expansion, the health insurance marketplace, navigators, and the mandate. And then we're going to dive a little deeper into what you can do to help your members and clients get ready and start enrolling in the marketplace, which opened October 1st. And to kick things off, we're going to hear from Kathleen Gemeiner.
Okay, well, I'm going to talk just briefly about some of the fundamentals of the Affordable Care Act. We're primarily focusing at this point on access to coverage, and the Affordable Care Act has two basic ways of making coverage affordable: through an expansion of Medicaid to all adults up to 138% the federal poverty level. It's about $15,800 for a household of one, and through the marketplace, which is the most used term now, but the legal term has been the exchange, so you may know it as the marketplace or the exchange, but it is the interactive online place where you can purchase private health insurance plans, qualified health plans, with financial help available to those who qualify. The Medicaid expansion, while it is the while it was intended to cover all of those up to 138% the poverty level, was essentially converted from a mandate to an option by the decision of the U.S. Supreme Court in 2012. And Ohio has not yet decided to accept the offer of coverage. That offer of coverage comes with the federal government picking up the tab for 100% of the cost of the care of the 275,000 people who would become eligible for Medicaid as a result of the expansion. That's for 3 years, at which point the federal share would drop a little and a little more each year until it got down to 90% by about 2019, and that's where it would stay. So actually, this is a pretty good deal for any state to have 90% of the Medicaid expansion picked up by the federal government. In contrast, with the Medicaid population that we serve right now, Ohio pays about 32%, and the federal government pays about 68%. As you can see from this graph that was developed by the Governor's Office of Health Transformation, the primary people losing coverage here are those adults who have no children living at home with them, because no matter how poor, they do not qualify for Medicaid under the current configuration. With parents, they would qualify for, they do qualify for Medicaid now if their income is below 90% of the poverty level. So the parents who fall in the coverage gap are those between 90% and 100%. But keep in mind that the intention was that, excuse me, people all the way up to 138% of poverty would get Medicaid. So you'll have some very, very poor people attempting to enroll in the healthcare exchange and pay their share premium. The marketplace is basically a one-stop shop for easy comparison of coverage options. It gives consumers more choice and control. If you think about it now, often there are very few plans that a consumer will even be accepted into. And if at work, sometimes consumers have no choice at all, or maybe a choice of only one or two plans. But in the exchange, depending on the region that you are in Ohio, the consumer will have anywhere from 3 to 8 plans, 8 companies to choose from, and among those companies, many more plans. There are subsidies for individuals and tax credits for small businesses to make the coverage more affordable. And there is a website and a helpline that can offer people assistance. And just so people know, Congress gets its health coverage through the marketplace. This particular slide that you're looking at now gives you an idea of what it is that people are expected to pay for their share of the premium. So for someone who's between 100 and 133% of the poverty level, they're expected to pay 2% of their income for their share of premium, and then the federal government will pay the remainder. And it continues to escalate. If you could just go back, Alyssa, to that previous slide, continues to escalate until it gets up to 9.5% at the top of the subsidy eligibility level, which is 400% of the poverty level. Okay, go ahead. The Marketplace has created a Navigator program, and the Navigator program is to inform people about their new insurance options and help people enroll in their plan of choice, and also to help people keep their coverage. Insurance brokers and agents are also there to help. At this time, they are required to be certified by the Marketplace, the federal Marketplace that serves Ohio, as well as by the state, to be able to sell in the Marketplace. The Navigator is not permitted to choose a plan or even advise which plan to choose, but the Navigator can show the consumer how to compare the plans and make his or her own choice. And finally, the Navigator may not be compensated by insurers to enroll people in the Marketplace. Ohio's House Bill 3 has been interpreted very strictly by the Ohio Department of Insurance, and so far 2 of our Navigators and I think 2 Navigator partners have returned their federal grants because they are reimbursed by insurers for providing medical services. The federal government is not that strict, but Ohio is. Next slide.
All right, okay. We're going to take our first poll for this webinar, and the question is, what is your biggest concern about open enrollment? And your options are, the website won't be fast enough, I don't know where to get face-to-face assistance, there will not be adequate materials in multiple language, or people we talk to have unrealistic expectations about the amount they need to pay. So let me launch this poll. So you should be able to click on the options now. Click whichever one you're encountering the most of the people you work with, what your concerns are about open enrollment. Take a few seconds here to get some more responses, and then I'll share the results with you to see kind of what everyone on the webinar is saying. Looks like it's about a 33% split between the first 2 and the last one. All right, thank you for taking that. I'll share the results so you can see them. So it's about a 3-way split between the website concerns, not knowing where to get face-to-face assistance, and unrealistic expectations about what people need to pay. Thanks for sharing those opinions with us. Kathleen?
I think we're at Nita. I'm sorry. Oh, okay.
Oh.
Wait a minute. No, I'm sorry.
No, it's Kathleen.
I'm sorry. Okay. So the Navigators that are serving Ohio are the Ohio Association of Food Banks, which has the largest grant and has about 20 partners in various parts of the state. I will just take a note here. This was the number to call when we first did this presentation several weeks ago, but they now have their toll-free number, which appears at the end of these slides. It's an 800 number. We'll get to it there. Helping Hands Community Outreach Center in Dayton is a certified navigator, and Neighborhood Health Association in Toledo. Neighborhood Health Association has a federal grant. I have not yet heard whether they've completed their Ohio certification. And this is a list of the partners that the Ohio Association of Food Banks has. So you can kind of, I won't read them all off to you, but as you can see, the food banks themselves are serving all 88 counties. And then there are other organizations that are serving parts in the Northeast, some such as Asian Services in Action, serving primarily Asian communities, but I'm not sure if it's restricted to Asian communities in various parts of the state. And then you see a lot more for Cuyahoga County. You see a few down here, Community Action of Pike County is doing 3 of our southern counties. Next slide. And then the Disability Rights Ohio provides services primarily to persons with disabilities in all 88 counties. The Free Store Food Bank just recently substituted for Healthcare Access Now, which was one of the partners that had to surrender its grant because of receiving reimbursement from insurance, some kind of money from insurance companies or foundations, I'm not quite sure which. And Toledo Lucas County CareNet, serving much of the Northwest. His Ohio Association of Free Clinics is in 40 counties. Department of Health all across the state, and another Southeast provider of navigator services, the Community Action Program of Washington, Morgan counties.
All right, now we're going to turn it over to Nita Carter, and she's going to talk about how you can help your members and clients get involved with open enrollment.
Okay, so there are a couple of roles that can actually do enrollment assistance. So Kathleen talked about the navigator role and those organizations across Ohio that have received navigator grants. I'm going to now talk to you about another role that can actually do enrollment assistance. In other words, actually do face-to-face enrollment assistance, help someone kind of go through the website. And as with the navigators, they can't choose the plan for them, but they can help them go through the website and understand how to enroll in the marketplace. So certified application counselors must be an organization. So first of all, we're not at the point where individuals can apply to become a certified application counselor. That may happen later. But certified application counselors can get the word out about enrollment. They can encourage them to visit healthcare.gov and sign up. Oh, I'm sorry, these are some other ways besides certified application counselors that you can also participate. So we're going to talk more about the certified application counselors in a minute. But some of the other things that you could do is help to get the word out about enrollment. You can encourage your clients to visit healthcare.gov and sign up for email updates. And healthcare.gov is the main website, so that is where someone would actually go to enroll. Another way is you could include articles in your newsletters. You could have print materials and handouts available for those that you serve or that you see. You can invite Enroll America to your meetings, and you could schedule a presentation with UCAN Ohio. So now we're going to talk more about certified application counselors. So certified application counselors are actually trained by the federal government to help people understand their choices under the Affordable Care Act. The good thing about this is the training is free. Certified application counselors are usually people working in agencies or organizations that are already helping people to secure health care or other types of social service benefits. And certified application counselors are not paid by the federal government. So navigator organizations actually got grants to provide these services. One of the biggest difference between navigators and certified application counselors is that there is no pay for certified application counselor organization. But there may be some private money available. Next slide. So to find out how to become a certified application counselor, you can visit this website, http marketplace.cms.gov, and they actually have an application there and information on how to fill the form out. The application is really short. It takes about 15 minutes to fill out, and some of the main things that you need to be as an organization is you need to have a place to keep secure confidential information. And then once you fill out the application, someone from the Center on Consumer Information and Insurance Oversight will contact organizations who appear to have the qualifications and get more detail. Now this process is taking a little time as they've had, when we talk about this website, they're getting applications from all over the country. So for instance, UCAN Ohio applied to become a certified application counselor, and it took several weeks before they got back to us to let us know that we've been approved. So an organization that wants to become a certified application should, as I said before, already be helping people to secure assistance of some kind and having a system to protect confidential data and screen volunteers and employees who may help clients to handle sensitive information. You also need to be aware of any relationships with insurance companies or others that might pose a conflict of interest and be prepared to discuss with Societal. Again, Kathleen mentioned earlier that there were a couple of navigator organizations that had some conflicts and that they were associated in some way with either a provider, health provider organization, or an insurance company. So if you are have that kind of relationship, you do need to think about it. You need to be prepared to enter into a written agreement with Societal. And again, Societal is part of Health and Human Services. And you have to identify who in your organization will be trained to be CAC. So you'll have to identify all those persons. So what are the benefits to becoming a designated certified application counselor organization? Certified application counselor designated organizations will benefit by receiving marketplace training and being able to represent themselves to consumers as being certified by their state's marketplace to provide application and enrollment assistance. And in addition, I think the second one is important. Becoming a certified application counselor will build the capacity of your employees and your volunteers, and particularly those of you that might be using volunteers. It will give them another skill or certification. How will the training work? The certified application training is a web-based program, and it can be completed at any time. You have to complete the training before you become a certified application counselor, and the training takes about 5 hours. We are finding as we go through it that it may take a little longer than 5 hours, but officially it will be it's a 5-hour training. Do all of your employees and volunteers need to take the training, or just those who want to become certified application counselors? Only those who want to be certified application counselors. And what does it mean to screen staff and volunteers who will become certified application counselors? Well, screening could involve background checks. It could involve calling past employers for references, checking government-issued identification, or other tools that will tell you whether the organization can trust the staff or volunteer to handle private consumer information responsibly and securely. And one of the things that you just need to think about is, in your screening process, these people will be, these certified application counselors will be sitting face-to-face with people, hearing their life stories maybe, and obtaining confidential information. So you need to think about, what kinds of checks and information you would need to know to feel comfortable with people doing that. Okay. And what level of healthcare knowledge should an individual already have to become a CAC? Well, there's really no minimum level of knowledge required for individuals other than completing the required training. And the training is going to tell everybody exactly what they need to know to help consumers apply for and enroll for coverage. But as we're finding, again, the training course, it does take a little more than 5 hours, and so the person has to kind of be committed, and there's a level of a lot of just there's some technical language, and that's kind of it. Next slide. Can a CAC actually help an individual compare health plans and assist the individual in choosing a health plan? Well, yes, those are the required duties of a certified application counselor. But remember that a certified application counselor can't actually choose a plan or enroll someone in a plan. A CAC can only assist with plan selection and enrollment and must provide this assistance in the consumer's best interest. Are there quotas for how many consumers each certified application counselor or designated organization must assist? No, there aren't any requirements for a minimum number. And how long, on average, will it take a certified application counselor to walk a consumer through enrollment? Well, the estimates vary, but typically it's going to be around an hour or more for each person. But estimates vary. It kind of depends a lot on what that particular person, their needs are. So the differences between a certified application counselor and a navigator, we've kind of covered this, but I'll say it one more time. Navigators are funded through grants through the marketplace by the federal government, and they have a strict conflict of interest requirements, and they're required to a conduct of outreach and education. CACs are not funded through the marketplace or by the federal government, but they may obtain some funding with other sources. They also have a conflict of interest disclosure requirements, but won't prevent conflict of interest disclosure requirements, but won't prevent from becoming a CAC. Okay, I'm going to have to go back to that one. And what is the difference between a certified application counselor and a broker? Well, unlike agents and brokers, the certified application counselors cannot charge consumers for their assistance, and they are not paid by health insurers to sell insurance. Agents and brokers are licensed by the state to sell insurance, and certified application counselors do not sell insurance, nor will they be enrolling individuals in health coverage, including qualified health plans offered through the marketplace. And how to become a certified application counselor? Think through how you plan to help people. Will you establish an appointment system? Are you going to set up certain days of the week, first come, first serve, clinics? Are you going to partner with others who are knowledgeable brokers and tax preparers? And also, are you going to maybe partner, maybe you don't want to become a certified application counselor, but maybe you might want to partner with another certified application counselor to actually have one of your staff trained. So there are lots of ways that you can think about this.
All right, thanks, Nita.
Mm-hmm.
So after learning a little bit about what becoming a certified application counselor organization involves, do you think that you'd be interested in becoming a CAC? Do you maybe need a little more information, or do you think you simply wouldn't qualify for the minimum requirements for being a CAC organization? So we'll launch this poll. You can click whichever one you think applies to you and your organization. And if you select that you need more information, we can have somebody follow up with you to get you the information you need to make an educated decision. It looks like I will close this poll and share the results with everyone. Looks like a pretty even split between all the categories. Thanks for sharing that. We'll get in touch with you if you said that you need more information or if you'd like to become. We'd like to help you, assist you in any way that we can.
So one more thing before I turn this over to Kathleen. I would like to say that for those of you who are from the Cleveland area or Cuyahoga area, we are actually going to have a kind of orientation to kind of begin to help community organizations think about their role in enrollment. And so that is going to happen this coming Friday the 11th from 10 to 1:30. And it's going to be taking place at Lutheran Metropolitan Ministries at 4515 Superior Avenue. So for those of you that are in the Cleveland area, you may want to join us for that discussion on Friday.
And we'll make sure to get you that information in the follow-up email that we send out after this webinar.
Okay, so there are some things that you can do with your members right now or your clients, your constituency, to help them understand more about open enrollment. You can put an article in your newsletter, and if you go to the healthcare.gov website, you will find that there are actually articles that you can just drop right into a newsletter. So it makes it pretty easy. Next slide. And this is kind of the way the page will look when you get there and the instructions to get there. So actually I said healthcare.gov, and it will direct you there, but you can go to marketplace.cms.gov and click on Get Official Resources, and then click on Publications and Articles. So you'll see this kind of a, this displayed just as you see it here on the slide, with the drop-in articles being over on the right and some of the fact sheets on the left. If you scroll down further, you will see that there are materials for people who speak other languages. Next slide. And this is one of the brochures that you can get at the marketplace, and when the slide deck is sent out to you by Alyssa after this presentation, then you'll be able to click, or hopefully you can click on the links that are right here on it and get there. But if not, you'll see it listed on the page that we just looked at. This one is one we've used somewhat. Go ahead, Alyssa, to another one. And that's like the second page. So just you can copy them, in your own office and then just fold them over. The one thing to mention is that all of these are offered by Health and Human Services to be sent out to nonprofit organizations, but we have heard that there's a backlog. I know we've recently put in our order, and I don't know how long that backlog is right now. This particular item here is called the value of insurance, and it's really helpful to people who haven't had insurance before. It helps them understand a little bit more about what insurance is, because you have to realize that, especially for young people that maybe haven't had health insurance, and maybe they haven't really, if they owned a car, then they've had to deal with insurance, but a lot of times they haven't owned a car, and so maybe they don't even really have much experience with insurance. So this is a really good pamphlet for them. And this is like a two-sided one. I've been using this a lot lately. It's very easy to print out, in a two-sided fashion, and it has a number of things, just very basic things, explains the marketplace, explains the categories, and the things that they will find when they get to the marketplace. So here are some questions and answers that you might get and that I'd like to go over just to familiarize you with them. Some people are certainly concerned about how they're going to get a subsidy if they're eligible. And a person has two choices. They can ask for the subsidy as an advanced tax credit, and that, of course, will be the most common way that people will receive their tax credits. And then the subsidy or the tax credit is paid each month by the IRS to the insurance company. I say each month. We know that between the IRS and the insurance company, it's probably going to be some kind of quarterly reconciliation process, but effectively for the person, it amounts to paying it each month. But the person also can, if they're able to, pay the premium up front and then get the tax credit at the end of the year as part of their tax refund. So for an example, if John has, if he purchases an insurance policy with a premium of $400 per month, and based on his income, he's responsible for $100 per month, then the federal government is going to be paying the insurance company $300, and John will be sending his check or other form of payment to the insurance company each month for $100 if he wants to keep his insurance in place. So we know that we get asked all the time from people, I've been turned down for insurance in the past because of a pre-existing medical condition. Can the insurance company still do that? Thankfully, no. Starting January 1st, 2014, the insurance companies cannot do that. So the plans that people enroll in now will not ask them any questions about their insurance status if they're going to be effective on January 1st. The only factors that the insurance company can look at to vary the premiums are the size of the household, the age of the applicant, where the person lives, like where within the state or within that marketplace they live, because medical costs are higher in some regions than others. In Ohio, we have 17 regions. And then tobacco use is a factor that can cause premiums to go up. And if I'm working, but I can't afford the cost of buying my employer's insurance, can I go to the marketplace where I might be eligible for a subsidy? That's a kind of complicated answer, because you can only go to the marketplace and get a subsidy or advanced tax credit if certain conditions are met. And basically, either the employer's policy has to not meet the minimum essential coverage requirements, or the share of the premium that the individual is paying has to be more than 9.5% of his household income. So his share of his premium has to be more than 9.5% of his household income. That's a hard test to meet. And just go back just one slide. But if the person can't, if the person can't meet it, they really should go to a navigator rather than just say, oh, I don't meet the standard, because how the income is calculated, and the navigator can actually be there to be of some assistance. Okay, next slide. And finally here, my spouse gets coverage from her job, but it doesn't cover me. So can I go to the marketplace and get a subsidy? And the answer to that is, it depends. The spouse can go to the marketplace and get a subsidy if the employer does not offer coverage for the spouse, or if the cost of the employee's share of premium is greater than 9.5% of the household income, which we just talked about, or the insurance doesn't meet the minimum value. So the important thing to note is that the employer doesn't have to actually contribute to the cost of the spouse's insurance to be offering it. If the employee can somehow purchase insurance for their spouse through their employer, then that's considered an offer. And next slide. So these are some things that individuals can do now. And when we say now, even though it's after October 1st and they can go online, we know that the website has been running slowly, and it's been difficult for people to get online and get all the way through the process. And so hopefully this is going to be remedied fully in a short time. But now people can sign up to get emails so that they can keep up to date with what's happening. They can find out all about their health insurance at work, find out if the employer actually offers coverage for the spouse. And even if the employer has traditionally offered coverage for the spouse, you might want to check again, because some of them are dropping that coverage if they're not contributing to it anyway, because they know that by offering it, it prevents the spouse from going to the marketplace. And you can find out your expected contribution, your estimated expected contribution, by going to the Kaiser Family Foundation and click on their calculator. You can estimate what your income will be in 2014, and also pull out your tax return, your most recent one, and your pay stub so that you have current income information. And then you can also create a budget that includes your share of premium. If your likely share of premium doesn't fit into your budget, you should still seek help from a navigator or a broker, because you want to see exactly how the income is counted, who in your household is counted, and these are things that it's best to be getting help for rather than just trying to figure it out for yourself. For more information, you can go to healthcare.gov. You can go to their helpline that is available on a 24-hour, 7-day-a-week basis, and the number is here, 800-318-2596. There's also a TTY number displayed on your screen. Online, you can go to healthcare.gov.
All right, now Nita's going to talk about some ways that you can get involved right now with open enrollment.
Okay, so we kind of covered a lot of these earlier on, but several ways that you can get involved. One is that you can reach out to UCAN Ohio to help you as you pursue your work. If you decide to become a certified application counselor, again, we are spending some time in community trying to talk to those organizations that do decide this is a role that they want to play and provide a little support to them. You can invite UCAN Ohio in to send a speaker to your organization or your faith congregation. You could also volunteer with Enroll America to canvass neighborhoods and table. You can stay informed by following UCAN Ohio on Facebook and Twitter. And you can also join our newsletter by signing up on our website.
All right, so now it's time for questions. We've got about 15 minutes left for questions. We had a couple submissions, but just to go over how to submit questions again, you'll see the questions box at the bottom of your GoToWebinar toolbar. Just type in your question, I'll see it, I'll read it out loud, and we can get Kathleen and Nita to chime in with their answer. Or if you'd like to answer or ask your question live over the phone and you have your audio settings enabled, either through your microphone or you dialed in on your telephone, just raise your hand and I'll check in with you and we can have you ask your question live over the phone. So let's get started with just a couple submitted questions that we already have. Let's see. All right, we have a question from Beverly, and her question is, if I am single, childless, and employed, do I have health coverage options? Do I have any options for health care coverage at a lower rate? So she's childless, single, and employed. Can she go to the marketplace and get it for a lower rate?
I guess the question is whether insurance is being offered by Beverly's employer. If insurance is being offered, then unless the share that Beverly pays of the premium is more than 9.5% of her household income, which it sounds like is just her, then, or unless the policy isn't really minimum essential coverage, sounds like she wouldn't be able to go to the exchange. But if she's unemployed, then she can go to the marketplace. She can go to the marketplace and get a subsidy. If her income puts her at under 100% of the poverty level, she's not going to be able to get a subsidy, and she's going to have to depend on Ohio accepting the Medicaid expansion.
And just to clarify those percentages, 100% is around $11,000 for a single person.
Okay, we have another question about if people have a pre-existing now, can they apply for coverage now in the marketplace if the pre-existing condition for all adults starts January 1st?
Yes, because the coverage won't start till January 1st. So they can apply now, and they won't have to be concerned about the pre-existing condition. But it won't start. If they were trying to get coverage that was going to start, let's say somebody wanted to be covered by November 1st, then they would have to go through the individual market and go through the process that someone uses right now where they fill out a very lengthy application and they identify all of their various medical conditions.
Okay. Can you explain how eligibility for a subsidy is based on individual income versus household income?
The subsidy calculation is really done pretty much the way people file their taxes. So let's say you're a single person living alone, no children, you're going to be a household of one most likely. But let's say you have a child, and maybe the child doesn't live with you, but you pay more than half of the child support and you claim them as a dependent on your taxes, then you would be a household of two. So it's going to depend on how you file your taxes.
Okay. Another question from Jennifer. She asks, where can I get a complete list of policies available in the Ohio marketplace?
I'm not aware that there is displayed a complete list without actually going into the website and applying for a plan, at which point you will be able to see a list displayed. There is a way to go on the website and see, I think you can see the names of the plans and the premium levels, but not the benefits or like the provider network or the drug formulary and things like that.
Okay. We've got a question from Mike, and he asks, if I'm not eligible for coverage from my employer because I'm considered part-time, but have an income way beyond the poverty level, like maybe around 250%, can I still get a subsidy in the marketplace?
Yes.
Yes. You would be eligible for a subsidy all the way up to 400%, which for an individual is around $44,000 a year. And of course, the more you make, the less the subsidy, and the less you make, the more the subsidy.
And if his income is at 250% of the poverty level or lower, like between 100 and 250, then he can get help with his out-of-pocket costs as well, as long as he buys a silver plan.
Okay. Another question is, what does a 19-year-old whose parents aren't insured, what are their coverage options?
They would again go to the marketplace and apply for coverage, and based on their income, they would receive a subsidy. Again, if they're below that 100% of poverty level, which is that $11,000, then the subsidies really wouldn't apply to them. But if they are making over that amount, they would go to the marketplace and then, choose their plan and find out about what their level of subsidies would be.
All right, we got a couple more minutes here to take some more questions. If you have any questions, submit them in the questions box, or you can raise your hand if you have your audio settings enabled, and I can open up the phone line. You can ask your question live over the phone. We got a question from Meg, and she asks, I know to receive the subsidy you have to have the silver level plan. Is it only the silver level or at least the silver level?
To receive a premium subsidy, you don't have to buy a silver plan. However, the premium subsidy is pegged to the cost of the second lowest cost available silver plan, like in your region. So you're going to get, the amount of money you're getting is enough to buy a silver plan. If you spend it, let's say, on a gold plan, you're going to, have to come up with more money to pay the premium. It'll stretch farther if you go down and buy a bronze plan, but the bronze plan has really high cost sharing, or at least higher than the silver. And if there's any chance you can qualify for help with your cost sharing, or your out-of-pocket costs, then you want to buy a silver, because that's where the silver comes in. To have help with your out-of-pocket, you have to buy a silver, but you can use your premium subsidy to buy any of the available plans.
Okay, we got another question about the Medicaid expansion. We talked about the importance of getting it passed. What will happen to people if on January 1st we haven't passed Medicaid expansion in Ohio?
Well, once again, what will happen is those individuals who don't have children and they make less than $11,000 per year, they won't really be eligible for subsidy. and so their their out-of-pocket costs are going to maybe be more than they can afford right now. If we do accept Medicaid expansion is going to cover all individuals, whether they have dependents or whether they are disabled, up to $15,000, I believe it's $800 and some dollars. So anybody that makes less than $15,000 would qualify for Medicaid, and then anyone above that would go into the marketplace and receive a subsidy.
All right, thanks. Couple more minutes for any last trickle-in questions. We can probably take a few before we wrap up. Are there any last words, Kathleen or Nita, you'd like to share with our participants today?
I just, really want to encourage any of you that indicated you were thinking about or you might be willing to be a certified application counselor to go online and look at the requirements and apply and then move forward on the training. And if you have questions about it, to call Nita or to call me. We can talk you through it. It's really an important thing to do. It's because of the slow start that open enrollment has had due to some of the web glitches and the fact that in Ohio it's taking more time just to get the navigators hired and trained and certified. I'm afraid that we're going to see a lot of people trying to get coverage in between November and December 15th, which is when you have to pay your first month's premium if you're going to get it starting January 1st. So if people were getting enrolling now to become certified application counselors, you could be good to go in November when the need is going to be the greatest.
Yes, I agree. And I just want to say thank you for joining us today. And again, if you are thinking about becoming a CAC, please do get in touch with us because we are trying to have conversations in the community to bring certified application counselors together to begin to think about how we can really make this work and what role different groups want to play and how we can all fit together to provide comprehensive navigation services for Ohio's residents.
All right, it doesn't look like we have any more questions. So at this point, I want to thank Kathleen and Nita for taking time to present today. And you're very welcome. Thank you. And I also want to thank all of our participants in today's webinar. Thanks for taking the time to learn about how these important changes will affect you, your clients, members, and constituents, and to learn what you can do to help now. Like we said before, we hope that many of you apply to become CACs, and please know that we're here to help answer any questions that you have about that. We will be sending a follow-up email to everyone with the PowerPoint, links to more information, and a list of ways to get involved, including that Cleveland conversation that Nita brought up and other webinar opportunities that are coming up. There will be a short survey that pops up when you exit the webinar. Please take a couple minutes to fill that out. It just helps us improve our webinars for the future. And if you have any questions, don't hesitate to contact any of us here at UCAN Ohio. You can find more information on our website, healthcare.gov. AARP.org has a great step-by-step resource to learn more about the Affordable Care Act. And then the KaiserFamilyFoundation.org has that subsidy calculator. Or if you'd like to refer people to our healthcare helpline, you can reach them at 614-456-0060, extension 233. We have Henry manning that line, and he will get back with you answering your healthcare questions. And then just a quick poll, if you'd like to join our email list, we're sending out updates with what's going on with the healthcare marketplace, webinar opportunities, action alerts, ways to get involved. I'll just launch that poll, and if you want to click yes to join our email list. If you've already joined our email list, maybe that's how you found out about this webinar. No need to click anything. This is just if you're not already on our email list. Click yes, and we'll make sure that we get you on our list. And here's our contact information for Nita Carter and Kathleen Gemeiner. Also like us on Facebook and Twitter. And like I said, we'll be sending out a follow-up email in the next day or two with all this information, PowerPoint slides, links to more information. Just want to thank everyone for being here again today. And this concludes our webinar.